It's run and set up by medical students of St George's Hospital, and they take doctors, surgeons and physicians to rural parts of Nepal to hold health camps.
This year for the HPN project I have been leading the student side of the project, and that means in getting together a team, liaising with NMC and putting together a camp that was hopefully a success for the Nepalese people. The main thing that attracted me to the project of HPN would be how student-led and student-focused it was. It gives an opportunity for students of all ambitions and drive within medical school to do something that's completely different to everyday life as a student in the UK. You come out to Nepal, work with completely different people, from doctors to students from Nepal and the UK, and put that together to actually create something that's really worthwhile for a community out in the middle of nowhere.
The really good thing about HPN is that the money that's raised by the students, this all goes to the people of Nepal. So there's no money lost anywhere, and there's a great opportunity to provide teaching sessions and educating not only the UK students but also the students of Nepal Medical College who we're linked to.
It's an electrocution wound, 7 days old. So you can see there's an entrance and an exit wound on each side.
And it's 2 wires then?
So he probably went in with a thumb and a finger, put his plug and socket in. He went to plug in the TV. And so that's... And he's been such a good boy because he's shown every doctor and we've learned a lot from him. Thank you.
At the beginning, the specialties involved with the rural outreach projects were initially just medicine and surgery, a lot of general practice and primary health. And over the years, we've tried to introduce more specialties, especially with the support in Nepal Medical College, bringing in all the surgical specialties, not only general surgery, but also ENT, ophthalmology, obs and gynae, but other medical specialties including paediatrics as well.
In every camps we had different faculties, but we generally concentrate upon the surgical patient because most of the doctors who come from UK, they are surgeons, I guess. So we concentrate more upon surgery, but to be able to provide better service, we tend to bring some of the other facilities as well.
My role here with HPN today is one of the visiting doctors. We're part of the medical side of the process, which means we get to see a lot of people here. Generally, we're doing a mix of general practice, but also really some things which go more towards the hospital medicine side. Provision of services locally, medically, of course, is limited at times. So when these health camps come around, people like to come out, bring their medical problems, whether they've been seen before or not, and then we really try and do whatever we can to help on the spot or facilitate their onward healthcare journey.
It's a general consensus that in all camps, most of the patients, they are normal patients. So normal patient, they just comes to camps to see the doctors, but out of that, 20% are genuine patients. So we ought to pick up those genuine patients and then give them the proper medications or surgical treatments.
Back home, we're used to be able to deal with chronic conditions by seeing patients repeatedly, build up a relationship and improve health over decades rather than over minutes. Over here, of course, we're visiting for a very limited period of time. So a lot of the people who come to see us come with their chronic conditions and really are looking for a cure we can't give. We are able to do some useful interventions in terms of that. Many people who present to visiting doctors from Kathmandu or from further overseas wouldn't normally present to their local healthcare post. So we're then able to signpost them into the national services, for example, TB, HIV, and even leprosy services. So those kind of people can then access long-term, round-the-year healthcare, which, although it did previously exist here, they might not have normally accessed.
So I'm actually processing the patients to go on from the local area to NMC. We have several streams of funding for doing that, so some patients will pay for their travel and their medication and have their operations for free. and some of the patients will be totally free, so we will provide their medication, their transportation and their operation for free. Some people need to go further to outpatient departments to start investigations that may lead to medical treatment, and those will have to make decisions upon how far we can actually support that treatment.
Sustainability has always been one of the underlying principles, but also one of the biggest challenges with organisations like HPN. One of Nepal's biggest problems is that 90% of its population live in rural areas, but actually 90% of qualified doctors live in Kathmandu. Nepal's solution to this problem is the health camp, like you see going on behind me here. The health camp takes the doctors out of the capital and into the rural areas where people can access them. They're then able to refer certain cases back to Kathmandu. This, however, of course, isn't the most sustainable option in terms of chronic condition management. And this is the kind of areas where we're looking to expand.
HPN has really evolved over the years. One of our visions is actually to find one health post that we can build a strong relationship with, along with Nepal Medical College, so that you can provide sustainable healthcare. So this way you can train the local doctors and other healthcare workers, and to build in that relationship so that they can become self-sufficient in that way. For example, if you go out to one of the smaller hospitals who do have some capacity to operate, but you can teach them how to do certain cases, then they may not need us to come again in the future once they're fully trained, or give them useful skills such as teach them how to use an ultrasound machine so that they can make a diagnosis so they know how to refer on.
I'm very happy that SPN is conducting medical or surgical camps in Nepal, because as you see, Nepal is a poor country. We have much of the rural area where the medical facilities are not good. So with the help of HPN and St. Joseph's, so we could conduct camps, and it is definitely helping poor people in the rural area.
I think there's a real bond between the NMC students and doctors and the UK doctors. And over the years we've learnt from each other and be able to make each project more efficient and better each year, and just really looking forward to every project in the future.